Hello everyone, welcome back. My name is Dr. Vijay Bhatia. I'm a psychiatrist working in the mental health. Today we are going to talk about what is psychosis. Psychosis is a syndrome. What does it mean? That means it's a mixture of symptoms that can be associated with many different psychiatric disorders, but is not a specific psychiatric disorder in itself. At a minimum, psychosis means delusions and hallucinations. It is generally also includes symptoms such as disorganized speech, disorganized behavior, and gross distortions of reality. So, psychosis syndrome. We said it is a set of symptoms in which a person's mental capacity, affective responses, and capacity to recognize reality and then to communicate with others and relate to others is impaired. So mental capacity, affective responses meaning mood, up and down, angry, upset, happy, and capacity to recognize reality. What is truth? What is real? They have problems with that, and they will have communicate problems because of their conceptual disorganization, and how to relate with others because they may be suspicious of others. All these things can be impaired. Disorders that require the presence of psychosis. As a defining feature of the diagnosis include schizophrenia, substance-induced, that is drug-induced psychotic disorders, schizophreniform disorders, schizoaffective disorders, delusional disorder, brief psychotic disorder, and psychotic disorder due to general medical condition. So schizophrenia is a cluster of symptoms, and psychosis syndrome is a defining feature of schizophrenia, and also substance-induced, that is drug-induced psychotic disorders. Substance-induced means either with hallucinogen drugs, amphetamines, stimulants, which can cause psychotic features as we discussed in psychotic syndrome, at least minimum of delusions and hallucinations. Schizophreniform, they look like schizophrenia, but they are not schizophrenia. And schizoaffective, meaning they have features similar to schizophrenia, plus they have mood symptoms present in short period or within the same episode. They are quite presence of both together, psychosis, either delusions and hallucinations, and their mood symptoms are prominent. Delusional disorders. These can be single delusional disorder, like person may be just having a delusion about that his wife is not faithful, the partner is not faithful, just one delusion. And the other one is brief psychotic episodes or disorder. This can happen in people like a personality disorder, especially borderline personality disorder, where they have acute, brief periods of psychotic symptoms with delusions and hallucinations. And psychotic disorders due to general medical conditions like Huntington's disease, Parkinsonism, they can be features of those general medical conditions. Disorders that may or may not have psychotic symptoms are associated features include mania and depressive disorders, as well as several cognitive disorders So mania may present with psychotic symptoms or may present without psychotic symptom. Similarly, severe depressive episode may be without psychotic symptoms, that means delusions and hallucinations, or with psychotic symptoms. Similarly, like dementia, Alzheimer's disease may present with psychotic symptoms like hallucinations and delusions and may not present with, so they are not the essential feature in this one, whereas in these schizophreniform disorders they are as a defining symptom. What are the psychosis types? Number one is the paranoid psychosis. This is very common in schizophrenia. It can be disorganized or excited psychosis. It can be depressive psychosis. So there are three main types. And any of these can be accompanied with perceptual distortions, and motor disturbances can be associated with any of these three psychosis types. More discussion on perceptual distortions in psychosis. We mentioned there will be perceptual distortions. That means there is some kind of perception, actual stimulus, and that is distorted, like illusion. Or they can be distressed by hallucinations. That means there is no perception, and that yet they are perceiving something, and they can be quite distressed by these, and this could be voices. Or the voices, they may be hearing voices that accuse them or blame the patient or threaten or even threaten punishment. It may be towards the patient or towards other people, so they are hearing these voices. And again, these are distressing. They may be seeing visions that are not there, or some visions are there but they are distorted, or there are some visions that are not even there and they see without any stimulus. Seeing people, seeing strange animals, aliens. They also report hallucinations of touch, as if somebody is touching them, poking them, causing them pain. Or taste, they may be tasting some food which is not right, tasting like metal, tasting like some awful substance, maybe tasting like a poison, and they may smell something, odor that is not there. They may say that I can smell the cow dung when nothing is there. So these odors may not be there and they are experiencing as hallucinations. Or reporting that familiar things and people seem changed. So they might say, my partner is changed to a different person, and suspects them in a negative way. So familiar things or familiar people may seem they are changed or look different, or their roles are different, and they have taken different actions against the patient. What are the motor disturbances in psychosis? We mentioned earlier, motor disturbances are peculiar, rigid postures. It can be like catatonia, that flexibility, that if you make them or hold their arm, pull it up slightly and leave it there, the patient will keep that arm there in that position as if it is like a wax or robot or some kind of machine. There may be overt signs of tension. You can feel that they are looking tense. Their muscles are tense. They might give you inappropriate grins or giggles for no apparent reason. They might be having some repetitive gestures like saluting you or trying to shake hands or not shake hands. So they may have, and these are repetitive, and these are motor disturbances in psychosis. Or you may notice that they are talking to themselves, they are muttering among themselves, just sitting on their own and muttering something as if they are talking to somebody, or mumbling to oneself. Or they may be looking around, glancing around as if they are seeing something unseen things by others, or hearing things by other people, that they are, as if they are hearing voices when no one is there. In paranoid psychosis, the patient has paranoid projections, hostile belligerence, and grandiose expansiveness. We will talk each one in separate. In paranoid projections, these include preoccupation with delusional beliefs. So delusional means they are false, fixed beliefs out of their culture. Believing that people are talking about oneself. So other people are talking about the patient. Believing one is being persecuted, that somebody is there to harm the patient or kill the patient, or being conspired against. Other people are talking about him. They want to create some kind of conspiracy against the patient. And believing people or external forces control one's actions. The patient will say, my actions, my behaviors are not under my control. They are being controlled by other people or aliens or external forces that the patient may sometimes explain as if through telepathy or through radio waves and other things. Hostile belligerence is verbal expression of feelings of hostility, expressing an attitude of disdain, manifesting as a hostile, sullen attitude, manifesting irritability, grouchiness, tending to blame others for problems, expressing feelings of resentment, complaining and finding the fault either with themselves or with others, as well as expressing suspicion of people. They may have grandiose expansiveness. This is exhibiting in their attitude of superiority. They think themselves to be superior. They may be hearing voices that praise and extol them, believing one has unusual powers, that they can do things that other people can't. They are a saint, they are a god, they believe in unusual powers, they can heal people, or is well-known person. They might think themselves that they are some kind of royalty or very famous personality, like an actor or artist or musician, or one has a divine mission. They have come to the earth, that they have certain mission to complete which is divine. That means they might be saving people or helping people or curing people. They get this idea in their mind. The other one is within the psychosis syndrome, the patient may exhibit disorganized or excited psychosis. There is conceptual disorganization, conceptual disorganization, conceptual disorientation, and conceptual excitement. Conceptual is like an idea or a thought, and that has certain boundaries, that has certain relation with other thoughts, and they must flow in a very nice relation, related with each other way, so that the whole meaning of the different concepts is clear. In these patients who suffer with schizophrenia or paranoid psychosis, there is this conceptual disorganization. They are not linked to each other. They might be blocked by one thing or the other. Conceptual disorganization can be characterized by giving answers that are irrelevant or incoherent, drifting off the subject, using some new words created by the patients themselves, or repeating certain words or repeating certain phrases. There may be disorientation, And conceptual disorientation is not knowing where one is, what is the season of the year, what is the calendar year, or what is their age. Especially in chronic schizophrenia, they tend to underestimate their age quite a lot. Conceptual excitement is expressing feelings without restraint. They will keep on talking about their feelings, and if you ask them to stop, they don't. Manifesting speech that is hurried, their speech content and the flow is very fast. Exhibiting an elevated mood, they appear quite happy, elated in their mood, and they have attitude of superiority. They believe they are better than anybody else. They may be dramatizing oneself or one's symptoms, and they may say that I can show you, I can do this, I can do that, which might be dangerous and maybe quite harming to the person or to the others. And this is manifested as loud and boisterous speech. They will go on the stage, go on the top of the mountain and declare themselves they have these special powers, and they are loud and boisterous in speech, exhibiting some overactivity or even restlessness, and there will be excess of the speech. So these all are disorganized conceptual disorganization, either in orientation or excitement. There is another third type of psychosis called depressive psychosis, and this is characterized by psychomotor retardation, slowing down, apathy, and anxious self-punishment and blame. So psychomotor retardation and apathy are manifested as slowed speech. The person is talking very, very slowly. Indifference to one's future. They are not worried about their future. Fixed facial expressions. Slowed movements. Deficiencies in recent memory. Blocking in speech. Apathy towards oneself or one's problem. Slovenly appearance. Low or whispered speech, and failure to answer questions. So they can have all this slowed down because of depression. Underlying depression is there, and their physical movements, facial expressions, emotions, they are slowed down in every way, and they don't care. They are not looking after themselves. The other feature of depressive psychosis is anxious self-punishment and blame. They blame themselves for something they may have done very small, but they believe they will be punished by the God or the divine power for something they have done, and the punishment may be not only to themselves, to the whole family. Is the tendency to blame or condemn themselves. Anxiety about specific matters. They may be quite mild, and they are so much concerned and worried about these all the time, causing them depression, or depression is making them feel like this. There is apprehensiveness regarding vague future events. Some major disaster will happen to themselves or to the loved ones. An attitude of self-deprecation, manifesting as depressed mood, expressing feelings of guilt and remorse. Preoccupation with suicidal ideas and unwanted ideas, and specific fears of something, and feeling unworthy, or they have done something really sinful act and they will be punished for that. Thank you for watching this video. If you like this video, please press the like button and share with friends. Subscribe the channel for more videos on mental disorders. Thank you. I see you in my next video.